All right. Well, good afternoon and welcome, everyone. For those of you here with us today, thank you so much for coming and chatting with us about, in our titled presentation or conversation rather, of Through the Career Looking Glass. If you're catching this on YouTube, feel free to continue the conversation or questions or thoughts in our comment section. My name is Dr. Chantel Caro, and I'm a professor in the gerontology program at UNCG. I primarily teach in our online graduate programs, which are either our post-baccalaureate certificate in gerontology or our MS in gerontology. I am so happy to be joined this afternoon by Dr. Autumn Henson, who is also a professor here at UNCG. Dr. Henson is faculty in the School of Nursing and more specifically serves as the Adult Gerontological Primary Care Nurse Practitioner Concentration Coordinator. What a name. The goal of our conversation today is to get to know a little bit more about Dr. Henson's background, how her career path has led to a focus on the older adult population, and perhaps some things to consider if you are interested in a career in nursing and what that might look like working with older adults. And I guess I should have put a context to all of this. This is our first event for Careers in Aging Week. So we are just trying to explore those diverse careers in aging and see what other professionals in different fields are doing when we're thinking about the older adult population. So to get started, Dr. Henson, how long have you been in nursing, perhaps in general, and then maybe more specifically working primarily with the older adult population?
So I have been started as a CNA, and I started that about 26 years ago, give or take. That I started as a CNA, and I worked in psychiatric medical center. So Broughton Hospital, if anybody's heard of Broughton, it's in Morganton. And I started there, worked in the med surg unit, and predominantly the population there were older adults. Then when I became an RN 24 years ago, I worked in the geriatric psych area of Broughton and did that for almost 5 years, 4 or 5 years, and then did a little stint in OR, and then came back into my world of gerontology. And so I started working in nursing facilities as an RN, and then wound care as an RN with in long-term care, and then became a gerontological nurse practitioner. And I've been a nurse practitioner for 17 years and practicing in long-term care the entire time. Um, Still practice 1 day a week. I go see my patients in their facilities and do wound care there as well, and then teach as an associate clinical professor here assistant clinical professor, excuse me, at UNCG, and I teach the older adult class. So it is my world. It is the world that I grew up in. I had older parents, and so my grandparents were a lot older than some of my friends' grandparents, and my grandmother was in a nursing home. And so I started out loving older adults when I was really young, um, and just never have stopped. And so that's kind of my background in a nutshell.
Thank you so much. I was just going to ask you that too about it seemed like your career kept on leading you or you kept on making choices that led you back to an older adult population. And I think I find that really common too with a lot of students that come to gerontology, in particular at the undergraduate level, as in my experience, that they've had really close connections with their grandparents, or they've had some type of caregiving responsibility, or they had older parents, and it just seems like that was what they were surrounded by. That's what really gave them a lot of joy, and that like steered them in their path in a lot of different ways. So awesome, thank you so much. Um, so in thinking about the many different areas you worked with older adults, cared for older adults, this is more of a, okay, now we have a little bit of a, here's where you have been in terms of skills. So are there any particular skills that you have found that are critical or vital to working particularly with older adults? Or have you found that it's kind of general across the board?
I think the older I get, the more I think it's more across the board.
Okay.
But a lot of times working with older adults, it's kind of where people assume they can't hear. And so then you start talking loud to them, and then they're like, I can hear you just fine. Or people assume that they have little memory. They have some memory or cognitive loss. And they're sitting there looking at you going, I probably know this better than you do. And sometimes they probably do, at least for my case. So a lot of times the skills with working with older adults is knowing the individuals and asking the questions of the individual. I love the memes where it's like a nurse standing looking in a mirror, older ladies looking in a mirror, and she sees herself as a young nurse, or an older gentleman looking in a mirror and he sees himself as a soldier. I think that's a good way of thinking about our older adults, is making sure we take into account who the individuals are. And I think that's a skill that we have to learn. Um, and a lot of people probably don't have that. I think, our older adult population, yes, we're supposed to respect them. Yes, we are. Should we make sure we ask the right questions? Yes, we should. Um, and I don't know if that's what you would consider a skill, but I definitely think it's something to consider when you're working with older adults. Um, I was talking to a student just today, and making sure you understand what your older adults are going through is a skill. It may be they're not going to tell you everything. They're not going to tell you what their life has been like. They're not going to tell you what they're going through, or if they can't pay for their medications, or they can't pay for food, or if they can't get transportation. They may not tell you because they don't, they're very private. A lot of older adults are very private people. They're of the generation that you handled it, you did it. Now, some will still tell you about their life story, but they may not tell you, hey, I can't pay for that medication. They'll just work it out. And so, a lot of times, it's making sure that you develop an empathy to how you relate to them, and develop a trust, and you don't assume.
Yeah, that's great advice. And I wrote down two things as you were talking, so I'm going to go off. Well, no one else knows. I'm going to go off my little script here. But the first thing that you mentioned really kind of hit me in a lot of conversations going on right now in gerontology as a field in general, around ageism. And I think that we oftentimes think of, right, when you were talking about like not being able to hear or memory, like how that might be in some context or in some way, our own ageist beliefs about what it means to age and the capability or ability of people who are aging. And I think the flip side to that is that I have very recently come across, kind of more clearly than I had in the past, is that older adults tend to have some of those ageist beliefs of themselves. And so I do think what you're talking about is a skill, right? Understanding our own positionality and what we are bringing as a nurse, as a gerontologist in education, wherever, whatever field, but what we're bringing when we're working one-to-one with a patient or a client, and how we have perceived age in the past. And I think that does, I don't think that oftentimes that comes right away. I think you're presented with situations where you're like, oh wow, maybe that was a bit ageist, or somebody hits you with, hey, that language isn't great. And so I'm wondering, in the context of nursing, how might you have seen that play out? Like, have you seen it where, like, your, I don't know how you call it in the nursing profession. I'm going to say like senior nurses, right? Those mentors, like somebody like yourself who's been in the field forever. Um, is that a situation where you're seeing nurses mentor younger nurses that are coming up and in these situations? Do you see that a lot in the profession in terms of like your teaching, right? Do you teach about, ageism and rapport and building trust with your patients? I'm wondering how that kind of presents itself.
So, well, one thing I love to ask is, how old do you think is old? That's a really good question to ask anybody. You know, if I ask my daughters that are teenagers, old is 40 to 50.
Oh.
And then I look at them and go, you know, I'm 45, right? And so am I that old? But then, you know, and my husband and I joke around about it. We remember we were high school sweethearts. And so we remember thinking old was 50. And now we're starting to hit on it. I'm like, honey, I'm not that old. Um, and then you start thinking, well, you know, is it 80? If you ask my dad, he would say, no, that's not old. You know, is it 100? You know, well, if you ask a 103-year-old that's possibly still living by themselves, it's not old. So a lot of it has to do with asking the patient how old is old, and really getting that information. Now, as being, I guess, a senior nurse, um, it's really in asking the students how old is old and how would you relate to them. A lot of times, you know, especially generational, we face a lot with what I did in my time in the 70s and 80s and 90s, or I guess 80s and 90s, to what my daughters do now is completely different. To what my father did in the 50s was completely different. And so having to have that approach and have that conversation about it, is going to be a big deal. And making sure the students understand that. You know, I think our younger populations, you know, I was raised with you know, there's World War II, there's Pearl Harbor, there's Vietnam, and of course, the approach to Vietnam when I was growing up is a lot different now, which is great because now it's make sure we respect our soldiers and, um, you know, bring that back. But I think a lot of it has to do with how people understand what people went through back then. and and not everybody likes history. I'm a history person, so I like to bring history into it. You know, even if you're discussing vaccines as nursing or just in the population, you know, you discuss vaccines a different way, you know, from one generation to the next. You may have to encounter it a different way or approach it a different way. And I think that's how we have to do things. Um, you know, one test that we can do, social workers do it, nursing do it, as far as gerontology providers, is we do a memory test. And part of that memory test is a clock drawing. And not too long ago, I had a student saying, but Dr. Henson, a lot of people don't see the clock anymore. It's digital. And it's like, oh, oh, that's right. Now, mind you, our older adults are still drawing a clock. They can still draw the face of a clock, well, unless they have cognitive loss. But many people still can look at a clock and understand that that's 2:45 or 2:25 looking at the hands of a clock. But as our younger adults are growing up, they maybe not see a digital clock. They may not see a regular clock. It's digital, you know. It's kind of like the joke about trying to think now, not mobile phones, but the pay phones.
Oh,
You
yeah.
know, the ongoing joke of, do you guys know what this building is? It's a payphone. You know, so I think that's how you have to think about it as far as an instructor and senior nurse to new nurses or new providers in the field of gerontology is, you know, you have to consider what they've went through. You have to think about it, and not everything's digital and technology, but a lot of older adults are better at technology than I am. So again, you can assume, you have to ask. Have empathy with it too, though. I
Yeah,
hope that answers your
absolutely.
question.
Oh, yes, yes. Okay, second part of my question, and you kind of brought it up too. Um, but I'll share a fun little aside. I was in a cognitive aging lab, and one of the tests that we did that looked at attention, and it was timed, was we asked our older adults who came in the lab to search for a specific number out of a phone book. And I was telling my students one time about that particular exercise, and they're like, where would you even find a phone book? And I
Hmm.
guarantee you that phone book was from like the 80s. The
Hmm.
phone book's been traveling with my professor forever. But in giving that example and in piggybacking what you were saying, I wonder if you've ever thought, and I think about this a lot, in particular with my own interest in health and sexual activity. I feel like either science evolves, so I think we evolve and adapt with changes. But I wonder how much change we'll see, in particular with older adults who are our younger baby boomers now, when they are now seeking perhaps more healthcare or going to doctor's office. I'm wondering, and maybe you've already seen this, or maybe some of your students have shared this. Like in my mind, I feel like that generation and maybe the generation after them, which wouldn't be millennials. Would it be millennials after baby boomers? I think there's one more in between.
Yeah, Gen X.
Thanks,
Gen
Rachel.
X. Yep.
That there may be maybe not less privacy in terms of keeping health concerns or issues to yourself, but maybe more of an openness to share. I just think that with the advent of so much discussion around, in particular around mental health, and there was just a big talk on mental health in older adults, that I just feel like we might be approaching a period of time, in particular in healthcare with older adults, that as generations continue to come through, that we might be seeing older adults more willing to share and more willing to potentially open up to providers about their needs, because there's less maybe of a stigma of you don't need it, like the idea of that you're coming off as the needy older adult or that I can't do anything, right? That stigma will hopefully lessen. Maybe I'm just super hopeful, but I feel like that could potentially be the progression. I don't know.
And I hope so.
Yeah.
I really hope so. I think it'll become more of people are looking stuff up now, and people are going to Dr. Google a lot for a lot of their health stuff and a lot of things that they need, whether it's not even just health related, that they go to Dr. Google to refer to. And then I think us as providers, working with older adults, we need to make sure we have the whole story too, that we have the background, we have the knowledge to support what they're looking up. The big turnaround into herbals and supplements is huge. We all are, there's one supplement out there for everyone, right? So I think it's making sure that we understand the risk of those herbals and those supplements to make sure that we can, educate our older adults about it. I think there is a little bit of a turnaround now where, it used to be you would prescribe medicine because you're trying to fix. And now we prescribe medicine to try to fix, but a lot of people are like, I don't want to take medicine. And I respect that. I don't either. So then they turn to herbals and supplements, which is great. However, some things can have harm and not benefit. So, just kind of that looking at one tiny puzzle piece of what are we getting ready to face, is going to be the catch of making sure that we're open with our patients. We know what we're saying, and our clients, our family, that we have the information to be helpful to them, because they will probably come out to us about a lot more stuff, but they may not tell us the whole story unless we ask.
Yeah, absolutely. I had another question, but I realized I need to do a pre-question. I would love for you to share with us a little bit about, right, you're the director for the Adult Gerontological Primary Care Nurse Practitioner concentration. I guess I want to know, what are you preparing students that are in that concentration to do, right? What are you focusing? What is their potential, not potential, but what is their focus after completing that concentration or that program? I guess I'd like to know a little bit more about what your students are doing.
So our students are already bachelor prepared nurses, registered nurses, and they come into our program. I always joke around, it's two paths into one. So one is the doctorate of nurse practice, so the terminal degree. And then the second one is they become an adult gerontology nurse, primary care nurse practitioner. And so what that is a nurse practitioner that typically works outpatient, but they can work in so many areas. So they can work in specialty patient clinics, they can work in urgent care clinics, they can work in primary care clinics, they can work in nursing homes, long-term care facilities, so many things. And so the adult gero is kind of tricky because actually that's adolescence up. So about age 13, all the way up to, Moses. So, they can see a whole entire population of patients, clients, residents, that can fulfill their needs to have a provider to care for them. Um, as nurse practitioners, we are in North Carolina. Um, we have a very good standing as far as providers, and we do an overall base care, so holistic, where we look at from our nursing background, how to care for patients and have that empathy and that sympathy and that compassion and those care bases. And we already have that nursing care plan background that we build off of and become a provider where we can diagnose and prescribe and manage and treat whatever diagnosis we need. And so, yes, we are in North Carolina. We do have our collaborating physicians that work with us. But, a nurse practitioner can in North Carolina be able to hang their own shingle. They can go and open up their own practice and have a collaborating physician that can, work with them. They don't even have to be in that office. And so you can have your own practice, you can have your own patients. So a lot of our students not only are going out to become these providers, but they're getting the leadership and administration to be able to do that in whatever situation. And so a lot of our students, we encourage, urban to rural areas, working with all the patients that you need to work with. Some will probably stay around town. They'll probably be in their cities and their communities from that, and others are going to go into rural. A lot of our students, we work hard to making sure that they are educated with social determinants of health, especially with the older in our older adult population, as far as in my class. Um, but they also have a great background with adult health, adolescent health, um, women's health. So there's a lot of background that goes into this that our students are going out and becoming um, excellent nurse practitioners for any area. So that's kind of the background of what we do. But then you also have the doctorate. And so with that doctorate is that leadership and administration and understanding how to what our colleagues that are PhD develop that great research and we move it forward. Not only do they move it forward, but we're moving it forward into quality improvement projects and evidence-based practice projects and just guidelines and moving it forward into our patient care and to whatever setting that we're in.
Oh my gosh, thank you so much. I had no idea that um, that the scope of patients or clients or residents could be so broad, right? 13 plus. In my mind, right? I'm coming from a purely gerontology background, so I see gerontological and I see 65. I don't think of anything else, quite frankly, outside of my own research, which kind of starts a little 50 plus. So that's great. I also think, I am so grateful that you highlighted that and that students hopefully who are able to see this on the YouTube or catch this, that realize, and I try to get this across to my students too, the flexibility of a background in aging and in gerontology. I think that it's a little bit harder, or I find it harder in gerontology as a discipline as it on its own to really showcase to students and highlight sometimes, especially at the undergraduate level, the flexibility in where this could take you, right? And what area you could work in with these skills and this background. But I think when you're presenting it in particular in a nursing background, I think the flexibility is completely apparent as a nurse practitioner with this particular concentration, I don't know if you'd call it a specialty. In my mind, it seems like a specialty. That you can be in a lot of different places, and I think particularly if you're interested in that older population, and I've not I did not I have not been able to get as great of a sense as I have been since moving here to North Carolina, but the need of our older adults that are in our rural areas And so with that type of degree or that type of concentration as a nurse practitioner, and the ability to start your own practice or to gain your own group of clients, in particular, if you are willing and able, I think going out in those rural areas, what a benefit to our own community. And I am talking particularly here in North Carolina. Certainly, I understand that there are needs for rural adults all over the country, and in particularly some of our more diverse populations like Indigenous older adults. But I mean, that's so cool that there's such I keep on saying flexibility, but it seems like a lot of growth, a lot of room to kind of expand, in particular as in your career and as your career can kind of carry on into the future. I have one more question, and then if Rachel has any thoughts, we can go there too. So in terms of the field of nursing, perhaps as a whole, and then certainly if you want to be more specific, where do you see? I'm always interested, right? I'm coming from a research background, and I'm often trying to share with my students the latest research, the latest articles, and particularly a lot of our students here in the gerontology program, in the MS program particularly, have an interest in caregiving. A lot of our students, caregiving and cognitive issues. And so I guess I'm always looking for, right, what is the next kind of innovative thing that I can share with my students around caregiving? What are people doing in this area? And so I'm thinking about this for the field of nursing, and I'm wondering, where do you see the field of nursing going, in particular with the focus on caring for older adults? Given that we know the older adult population is continuing to rise, not only in the US, but globally. I'll keep it to a US context unless you have any insight to a global context. Where do you see any changes that are really exciting to you? Or do you see areas that need to change that maybe you're not seeing are changing fast enough for what we're potentially being or currently being presented with kind of a growing older adult population? I guess your thoughts in that area.
So I definitely think we need more people to work with geriatrics and older adults. That's number one. You know, even nurses are not going into, not as many nurses are going into older adults as they are going into, you know, maternity or
Everybody
pediatrics.
wants to do the babies.
Everybody wants to take care of babies.
But the birth rate has declined, people.
They have. And so, you know, our highest population is our older adults. And so, you know, and I think there's even that side of looking forward into getting more people interested in working with older adults. You know, everybody says, well, that's the top population. Yeah, it's the biggest population in the world. You know, people are living older and longer, and you know, there's a lot more stuff that we're finding too, you know, with comorbidities and diagnosis and disease processes that we didn't know because people didn't live to be 103. Or if they did, they were super healthy and have a lot of genes that are backing them up. And so I think a lot of times, as far as the future of nursing, the far as future of older adults is staying updated, is really just going out and looking for the information. The biggest thing I think the future of the world is, we learned it from COVID, is a Zoom meeting, is telemedicine. However, our older adults, some, not all, some, still lack that technology, that base, that background. And I think that's probably going to be step one, is let's get that resource out to them that they can understand. You know, I feel like I'm technologically okay savvy, but I had trouble doing a televisit when I had COVID 2 months ago, and couldn't get on, just couldn't do it. I was just like, I just can't even figure this out. So, you know, if you're an older adult who does not understand technology as well, you know, because it's not something you've had to anything you've had to have, I think we want to change the world into telemedicine because we can reach our patients in the rural areas or lack of transportation or whatever. But we need to realize that we need to start backing up and getting the resources to them that they get and they understand. Um, you know, we were just discussing about how, switching to Teams and going from Zoom to Teams. I can figure out Zoom pretty well. I don't know if I can figure out Teams, but I'm going to learn. Making sure that the future is still catching up. Our seniors are able to catch up with the future. I think, as far as nursing, I think as far as healthcare, we are reaching so many more people, so many more populations, so many more older adults that we just need to make sure they catch up with us. And that's kind of where I can see the future of healthcare, the future of our older adults. I also think that we all have to be a team, interprofessional, interprofessional, interprofessional and interprofessional. I can't remember the two opposites, but one's in nursing and one's in everyone. I think we all need to learn how to communicate together. I know we have these lovely electronic medical record systems, but they can't even talk to each other. And so I think we need to work on our future ability to communicate. And sometimes it might just be picking up a telephone, or putting a good documentation in there or something. And I think that's a future that we all have had to work on for years. And now it's really raising its ugly head as our older adults become older and older, and they have multiple people that they see. Just in the healthcare system, they may see 3 or 4 specialists and then their primary care provider. Um, in the world of making sure we understand what case managers are doing, social workers are doing, your colleagues, understanding how to work together to take care of our older adults. Because even if an older adult lady lives 1 mile from Cone Hospital, doesn't mean she's going to get the best care. And I think we have to be a team to understand that and hear what she needs, figure out how we can help her, whether it's telemedicine or whatever. There's a lot more resources out there than there were 20 years ago, when my grandparents were, a little bit younger, that we have now. But if our older adults aren't caught up with us, then we're doing them a disservice. And I think that's what we have to understand. So to answer your question, what do I see in the future? I think telemedicine is going to be in our future. And I think our world is now developed that there's so many other resources out there. But I do think that we do have a disservice to our older adults that we're not catching up with them.
Oh, thank you so much. I cannot agree with you more. I actually just did a presentation out in Chatham County for their health expo around technology and technology and aging. And I got to tell you, the amount of moans and groans around technology and use and cell phones and then when we got to telehealth, I got a kick out of it, right? Because I got a little interaction. But I not only think it's not providing the resources or maybe even the education, but I think I think people say, oh, we have the app or, oh, we have this service. I really do think the infrastructure is incredibly lacking in terms of all of those telehealth. I mean, I can't tell you, my husband tries to get on one of the like a telehealth call, right? Because he just needs a check-in. Just want to see how you're doing. Doesn't need to do any labs or anything. We have never, not once, been able to use the app. In the end, the provider always calls us. Actually, a nurse practitioner, she's wonderful, always calls us. Couldn't figure it out. Kept on getting, we're already 15 minutes into your appointment. Let's just talk on the phone. Every single time. And we are both pretty handy technology people. And it's always the two of us. We're both there trying to figure out. He's on the phone. I'm on the laptop. One of them's got to work. Never works. And so I really do think that we have all these things out there, but I completely agree with you. Like the infrastructure is incredibly lacking still. And I think we just got so excited that we have this now that we still need to continue working on, okay, if we want to get in the hands of older adults, we need to make this so that it's actually going to be working, I don't know, 90% of the time, maybe. Just try to be a little bit more efficient.
The people who are developing those softwares are not the people having to use them is the problem.
Mm-hmm.
Yeah.
That's
like
great insight.
Yeah, it's true. And they have the background knowledge and they know how to make it work. They can troubleshoot it. And if we can't troubleshoot it and we're the ones sitting here on this lovely telephone on this Zoom call discussing it, and how to troubleshoot things, how are the people that, one, may not have Wi-Fi, two, are going off of cell phone towers and cellular service, and three, don't even understand the app or what's going on. We're giving that's not fair. And that's what we have to make sure we keep in mind.
Well, connects back to your team point, which I also love, right? Because we like to say gerontology is multidisciplinary, right? Having people like you, like myself, like an older adult, probably the most importantly, on these teams, right? We're trying out this app. We'd love to know how you're interacting with it. Can you even figure it out? Give us your feedback so that these developers and the people behind the scenes can take feedback from the actual people, in particular those perhaps, I don't always like saying this, but those more vulnerable populations. I don't always like using that term. To get their insight, to get their feedback on like, hey, how can we make this work better for you? So I mean, I think it goes right back to your team's point for sure. Oh my gosh, well, thank you so much. This has been great. Before we wrap this conversation up, perhaps, Rachel, I don't know if you'd like to introduce yourself since I know you, but if you'd like to introduce yourself to Dr. Henson and if you have any thoughts on our conversation today.
Yeah, absolutely. So hi, Dr. Henson. I'm an alumni from UNCG's Gerontology program. I was in the last cohort to be on campus before the program went totally online. So I had that, I feel like lucky window of time that I got to network in person and do in-person classes. But after graduation, I went to my first job was to be director of an adult day health center. And then I went from there. I was there almost 2 years or a little over 2 years. And then I went to another adult day health center for 2 years. And now currently I am in Durham, downtown Durham, working for a nonprofit called Senior Farm Assist. So what you were talking about earlier, where they can't afford their medicines or they may not tell you about, housing or transportation, or if they have enough food, we look at the holistic, approach to a person. We help people pay for their medicines who fall into our financial eligibility and income guidelines. And then we also do community resources and referrals for food, housing, transportation, caregiver support, like all kinds of different resources and referrals. And that's my primary role here is screening people, getting them appointments, and then the social worky portion of it is those referrals. So I really am enjoying it. We also do Medicare counseling. We're the SHIP coordinating site for Durham. And so I'm SHIP certified. I help people with their insurance and help them navigate, which is a hot mess. Oh my word. So that's a piece that I didn't have before. And it is so important, like that you have the right insurance or else you don't get care. Medicare Advantage plans, they have pros and cons, and they're, good for some people, not good for other people. But at the end of the day, it's so hard to navigate Medicare and all plans, and you get prior auths and denials and appeals, and it's just a crazy mess. But anyway, so we help people with insurance and with SHIP counseling and troubleshooting when they get themselves into a problem or they cancel their insurance and signed up for something they weren't supposed to be in. And so it's been never a dull moment.
No, it never is. Not with that role.
Yeah. So I've learned a ton since coming here. And I feel like I just keep putting tools in my tool belt because I don't know what's next for me. And, you know, I'm not looking to change jobs right now, but at some point I probably will not be here forever. And yeah, so also when I was in grad school, I wrote a business plan for an adult daycare that was also a farm and like a venue for events like weddings or whatever on the weekends. So like you make money on those venue events and you use that to offset your negative costs.
I like it.
Adult daycare farming. So yeah.
Do it. I'll come if you have chickens. I love chickens.
You'll come if I have chickens? Okay.
There you go.
I love chickens.
Oh gosh. So anyway, I would love to do that someday as my like pie in the sky dream. And of course, adult daycare, there is no money in that. And so I will keep dreaming, keep working on it.
Well, it's nice to meet you, Rachel.
Nice to meet you too.
Well, thank you so much for joining us. And thank you again, Dr. Henson. It has been a pleasure to chat with you. Thank you for giving us all of your insight and expertise in the field of nursing, in particular with our older adult population. I hope we do this again. We will figure out a way to do this again. Maybe Careers in Aging Week 2024. You never know. But thank you again so much. For those of you watching the recording, comment below if you have any thoughts, opinions, insights on our conversation today. And check out our remaining Careers in Aging event, or Careers in Aging Week event. We have Zoom chats on Tuesday and Thursday. Tuesday with our director, the director for the National Association for Professional Gerontologists, and then Thursday with gerontology alumni from all over the state. Well, not all over the state, but various areas of the state. So we will love to catch you then too. So I will bid you all farewell. I'm going to stop recording.